We've heard not to worry, but then we've also heard concerns, so we wanted to look at the facts. We found another criminal complaint against Rittenhouse's friend, Dominic Black. Now, he is accused of buying the weapon for Rittenhouse back in May of 2020. You may have received a nice raise, but the effects of inflation are cutting into it. Any player refusing to submit to required virus testing under the screening and testing protocol will be hit with a $50,000 fine.
It will end the pandemic. It will end the pandemic.
If you've been fully vaccinated, you no longer need to wear a mask.
AP reports that scientists expect COVID-19 will eventually settle into becoming a more predictable and seasonal virus like the flu. But we just haven't gotten to that point yet. And President Biden said back in May that if you were fully vaccinated, you didn't have to wear a mask. That has not remained the case. The CDC changed its guidance back in July. The CDC now suggests vaccinated folks wear masks indoors in areas of substantial or high transmission. And of course, we have the ongoing debate about mask mandates. Another thing, the definition of fully vaccinated could change to including a booster shot. Ryan, vaccines reduce the risk of severe illness and death from COVID-19. However, they were not the cure for the COVID-19 pandemic. So we've heard not to worry, but then we've also heard concerns. So we wanted to look at the facts. The World Health Organization designated Omicron a variant of concern last month and described it as, quote, a highly divergent variant with a high number of mutations. Now, it was first detected in South Africa. The cases there have been mild, according to Dr. Angelique Coetzee. She also says vaccinated folks who have been infected have not gotten very sick. That their proposed $1.75 trillion spending bill works to lower drug prices. Now, it would allow Medicare to negotiate drug prices. That's according to the White House news release. But it has limits. Only drugs that have been on the market for a certain number of years are eligible. Pharma, one of those lobbyists we discussed earlier, they've spent more than $22 million this year. And a lot of that money pushing back on this provision of the spending plan. In a letter to Congress, they say that Medicare negotiation would, quote, threaten patients' access to medicines and sacrifice future medical advances. They also say that this would allow the government to set prices and decide what medicines patients can and can't get.